If you're approaching your 65th birthday and wondering if TRICARE will simply take over for Medicare, you're not alone. This is one of the most common points of confusion for military retirees, and getting it wrong can have real consequences for your health coverage and your wallet. So let's clear up exactly what happens to your TRICARE and Medicare benefits when you turn 65. First, here's the bottom line. TRICARE does not replace Medicare at 65. In fact, it's the opposite. TRICARE doesn't replace Medicare, it requires it. Once you hit that milestone birthday, you're required to enroll in both Medicare Part A and Part B if you want to keep your TRICARE coverage active. If you skip this step, your TRICARE benefits can actually stop, leaving you with a gap in coverage. So, what really changes at 65? Before this age, you might have TRICARE Prime, Select, or another version depending on your status, and it works as your main health insurance. But after 65, your coverage shifts to something called TRICARE For Life. This isn't a standalone plan. Instead, it's designed to work alongside Medicare. Medicare becomes your primary insurance, paying its share of your medical bills first. Then, TRICARE For Life steps in to cover most of what Medicare doesn't pay, like deductibles, co-pays, and co-insurance. Used together, these two plans can leave you with very little out-of-pocket costs for most services. But here's where many retirees get tripped up. Enrolling in Medicare isn't always automatic. Most people have a 7-month window to sign up, starting 3 months before your 65th birthday, your birthday month, and 3 months after. Miss this window, and you could face a lifelong penalty on your Medicare Part B premium, plus a gap in your TRICARE For Life coverage until you're properly enrolled. If you're still working and have employer health coverage, different rules may apply, so it's important to double-check your specific situation. What if you decide not to enroll in Medicare Part B? Unfortunately, that doesn't mean you just keep TRICARE as your only coverage. Instead, TRICARE For Life will stop paying its share of your claims until you're enrolled in Medicare. Combine that with a late enrollment penalty, and a simple oversight can become a costly, ongoing problem. Some retirees also consider adding a Medicare Advantage plan. In certain cases, you can pair this with TRICARE For Life to get extra benefits like dental, vision, or hearing coverage that TRICARE doesn't include. It's not the right fit for everyone, but it's worth exploring if you want more comprehensive coverage. If you're unsure about your next steps, don't guess. Reach out for help to make sure you're covered the right way as you turn 65.